So today we did our introductions. We're going to just do an overview of the data collection process. I want to review the target population that we're enrolling and serving in the pathways evaluation. I want to review the referral process and the screening tool specifically. I'm going to talk briefly about informed consent and the baseline survey that'll be completed. And there'll be one more training as a reminder in June. There's going to be 4 options to choose from. You only need to attend one, and that'll be the final training on the actual enrollment process before we begin enrollments that are still expected to begin in July. And then we'll look at those tools. There's some adjustments from phase 2. We've tried to make it a little bit simpler for everyone. And we have the WAI that will review the Working Alliance inventory. I'll briefly talk about the continuous quality improvement and fidelity monitoring process that the evaluation team will be conducting throughout the course of the evaluation. And then we'll get into the nuts and bolts of the system logged in, and Savannah is going to take you through how to enter data. Next slide. So we did introductions, the primary points of contact for the evaluation. You can always shoot me an email or call me. I'm available. I'm the lead evaluator. And then Savannah is going to be your primary contact for all things related to data collection and system questions. So any PMIS issues, get in touch with Savannah. And then Hillary's going to be providing technical assistance on the monthly monitoring calls that we'll be doing, and anything evaluation related. You can send that question to Hillary or myself, or all 3 of us. You're going to get a response. So we're available and we're here to support you guys throughout this process. Next slide. So first, I just want to briefly kind of review why we're doing this. You know, you've heard about the history of YARH, Youth at Risk of Homelessness, that was funded by the Children's Bureau. And I just want to reiterate, you know, Colorado is really at the forefront here. We're the only site that was awarded this phase 3 summative evaluation. The Children's Bureau and the Office of Planning, Research, and Evaluation at the federal level, the U.S. Department of Health and Human Services, you know, we've shown in Colorado in phase 2 that our findings look like we have positive outcomes, short-term outcomes for youth at preventing homelessness. And so we are building evidence in this phase 3 statewide to look at this pathways intervention. And you know, the best way to do that is to have a comparison group and look at their results and their outcomes compared to the services that we're providing through the pathways intervention to build that evidence base. And so at the end of this evaluation, which is going to be, you know, 4 or 5 years from now, we're going to compare outcomes and see where the youth in our comparison group, what outcomes related to housing, employment, education, health and well-being, where they're at related to our youth that have been served through this intervention. And, you know, hopefully have some positive outcomes to report. That's how we build evidence. And that's the whole purpose around this phase 3 summative or impact evaluation. How do we do that? We collect data, we analyze data, and we report data. And so we're only as good as the data that we enter and collect. And that data that we're going to look at in phase 3 is primarily in the data you're entering in this system, PMIS. And then we'll also enhance that with administrative data from trails. And then we'll also look at some qualitative data through focus groups and follow-up interviews that'll be conducted with the youth who have been served not only in the intervention and the pathways model, but also our Chafee youth that are receiving services in our comparison counties. So you can go to the next slide then, Savannah. This is, you know, busy screen here. This is our theory of change. And again, back in phase 1, it was kind of refined in early phase 2. A theory of change, you kind of start at the bottom with the assumptions and read up to the top, because that's what we hope to achieve. These are the assumptions. This is the intervention that we're providing. These are the conditions that exist. And then here's the outcomes that we hope to achieve. So this is in the manuals. We mailed hard copy manuals to everyone, also available online. I just wanted you to be aware of the theory of change that exists, kind of the model that was developed. And, we spent a lot of time reviewing this, editing this, refining it to get it to the point of this phase 3. Next slide. So the target population that we're enrolling in the study and providing pathways intervention services to are basically Chafee eligible youth. We started out back in phase 1 with, target population 1, 2, 3. We went through many different iterations of refining that target population. And now for phase 3, we're looking at current or former foster youth involved in the foster care system who are at an increased risk of homelessness. We know that not all youth that you serve are going to fall within that category, but we do know the majority of youth that you serve will fall into that category. And how do we determine if they're at an increased risk of homelessness? They answer yes to one or more questions on our risk screen, our screening tool, which we'll review here in just a minute. But pathways eligible youth that we're going to enroll and serve in this study are Chafee eligible youth. They're age 14 to 23, and they have an increased risk of homelessness by answering yes to one or more questions on the screening tool. We want to identify youth in a variety of ways. We know that most commonly they're youth in the system that you serve that because of their age or circumstance become Chafee eligible. And certainly we're going to enroll those youth. But we also want you to think kind of outside the box of referral partners. So what service providers in your community can you reach out to and develop that relationship with in order to, touch more youth, identify more youth, enroll and serve more youth. So we want those strong connections with our runaway and homeless youth service providing agencies that we all have. Build upon those existing relationships to strengthen those connections and develop that referral process where there's a point person at your RY agency that is in contact with the Chafee worker, your navigator, maybe your supervisor. We'll leave it up to you to design that process, but we want to make sure that we're identifying and outreaching to the community to identify youth that are currently on those lists, because we're going to serve them in trails, but we're also going to expand the kind of pool of youth that we're hoping to reach out to. And it's not just your RY providers. It might be your local food bank. It might be churches that provide services in your community. I mean, you can think outside the box. I mean, you guys work in the communities, you know who those partners are. And so we want you to reach out, develop and build those relationships with them, and then identify a process for identifying, completing that screening tool and referring them into pathways to the navigators. Any questions that have popped up as I've gone through all this? Feel free to unmute yourself, or again, can put your questions in the chat. Next slide, Savannah. So this is just an overview of the tools that need to be completed for every youth that is enrolled in the study that you're providing services to. The intake process, so that's at the beginning. I've already mentioned the screening tool that will be completed in the system in PMIS. Then there's the informed consent and baseline survey that will be completed externally. And again, that's the training in June. The youth will conduct the informed consent process, and then the youth will complete the baseline survey. Mathematica is going to mail phones out to everyone, all of our navigators, and also all of our Chafee workers in our comparison sites. And that phone will be used to hand to the youth if you're meeting with them in person, and they'll just click on a link and complete the survey. So you don't have to sit there, and you're welcome to, but it's not required. The youth can take that on their own, complete it, and then hand the phone back to you. You can also, there'll be a link that you can text to the youth if you're meeting with them in, over the Zoom or video conference or over the phone. So we're going to make it as easy as possible to get that link to youth, because we want to make sure that that baseline survey is completed. Donna, did you have a question? Oh, okay. So during the intervention, so after we've completed the screening and enrollment process, they've completed their baseline survey, you're going to begin to provide services to the youth, begin to build that relationship with them. As part of that, you're going to record in the system the case management records. That's kind of the main point, or the main part of the system. PMIS is just recording how many interactions you have with the youth, how long they last, and what you've talked about. We don't need extensive notes. We've designed it to be very user-friendly, where you click a box and kind of just select, so you can quickly keep track of that meeting. You're going to identify and set 2 goals that we talked about in the intervention training last week. You can record those goals in this system, and you can record kind of access or achievement, if they've achieved those goals, also in PMIS. And then I mentioned the tools. There's just one tool during the course of the intervention that has to be completed. That's called the Working Alliance Inventory, the WAI. We do that at 2 points in time. We'll go over that here in just a little bit. And then finally, the graduation checklist, which is built into the system. When the youth is completing the intervention, you can go through and check a few boxes that they meet the graduation criteria, and that's it. Next slide. Any questions, I guess, on these tools? We're going to go through them so you have a good understanding of them, but that was just an overview. If anybody had any questions, I can answer. Okay. So again, just to review the screening and enrollment process, every youth will complete the screening form. That's going to determine their eligibility for enrollment in the study and receiving navigator services in the Pathways intervention. You're going to record the screening tool in PMIS, and then the navigators will gain informed consent. You'll read a script from Mathematica and check a box, and then have the youth complete the baseline survey on their own. And then the youth is enrolled, the intervention begins. Next slide. Again, just to review the screening tool, you have a hard copy of it in your email. There's a documents tab in PMIS that also has a hard copy. You can download and print it if you want a hard copy to complete, but it's built into the system, as you'll see, and to be completed in there. So we record the data in there. Next slide. So the informed consent process is something that, again, the Mathematica team will review with you in June, but I want to make sure that you're all have a good plan in place. And I know Nicole's on the line from Boulder County, and she might jump in if there are any questions about this process. But in order to enroll a youth in a study, you have to enroll anybody in a study. You have to gain informed consent. You have to let the youth or let the study participant know what they're enrolling in, and inform them of any potential harm or risk to them. The agency, or there's a governing body called an IRB, Institutional Review Board, that reviews the study protocols and deems that the study is of limited or no risk to participants, and then we can enroll people in the study. So you just have to inform them of that. And so the navigators are going to read a script, and we don't want you to read it word for word. We want you to kind of become familiar with it and inform the youth of their participation in the study. You will gain informed consent by asking them if they'd like to be enrolled. It's completely voluntary. And you will then click a button. If you're in person with the youth, you can hand them the consent paperwork, and they can sign it. But it's designed to be a pretty seamless process. We call it consent for youth who are 18 or over. For those youth under the age of 18 in the custody of the county, those youth, the caseworker is able to provide assent for youth who are under the age of 18 to participate in this study. And then again, it's completely voluntary, and if the youth does not want to enroll in the study, that's fine. You can still provide services to them. You just will not complete any of the forms, enter them into this PMIS system, and they just won't be part of the study. Now, with that being said, typically there's a very, very small refusal rate. So a study refusal rate, typically you would see well below 10%. You would want it below even 5 to 7%. If the consent process, if you have a higher refusal rate than that, then we need to review what is happening in that interaction and process, because it just needs to be adapted. You want a pretty low refusal rate. You typically don't see a refusal rate higher than 7% in a study. So again, this process will be reviewed in June. But I guess one thing that I'd like to ask you all, get you to thinking about, is the ability for to provide assent, the caseworker to provide assent at your site to enroll in this study for youth under the age of 18. That was something that we worked out in phase 2. And I know there was some, it was a topic of discussion that we worked out, and we came to the conclusion that each site's caseworker was able to provide assent. Do we have any questions about that? Great. Next slide. So we don't need to go into detail on the intervention again. That was the training last week, but just as a reminder, you're going to be developing that relationship. The coach-like engagement piece is the core component of the intervention that you'll be providing. What that looks like typically is a once-a-week meeting. Those meetings can look very differently from week to week. It could be a brief check-in over the phone or a text message. It could be a 2-hour meeting at Starbucks to build that relationship and work through setting goals. You're going to record all of those interactions in the system in PMIS, whether it's a brief text or a 2-hour meeting or anywhere in between that. You're going to work with your youth to set those goals and document them in the system. Those goals are related to the outcomes that we hope to impact through this study. And then, we want to make sure those goals are set. Typically, they can be set around 30 days, but, within 90 days, certainly of enrollment, because it is kind of a time limited intervention. And we'll keep track of those goals and review them through the data in PMIS. Next slide. So the Working Alliance Inventory is an evidence-based tool that was developed from researchers working with some younger aged youth who are at risk of homelessness. And it's really a measure of that coach-like engagement relationship. And so we've adopted this. The federal evaluation partners adopted the WAI, or adapted it for the Pathways intervention. And this is our main measurement of the coach-like engagement. So it's evidence-based. It's used in phase 3 as our measure for coach-like engagement. And it measures the collaboration between our youth and our navigators. It's confidential for the youth, that the navigator is not going to see the youth's response to their questions. And likewise, the youth is not going to see the navigator's response to their questions. So you both complete it. And we're going to collect it at 2 different points in time. We're going to collect it 6 weeks, approximately 6 weeks after enrollment, or after about 5 meetings with the youth. I know that sounds very specific, but just so you all are aware, it's really designed to be completed after you've started to build that relationship with the youth. So it's not designed to be completed, at your first meeting, for example. We want to kind of see where that relationship starts, and then 9 months after enrollment, what their reactions are to that coach-like engagement work that you've been doing with them. Next slide. The WAI, this is the navigator version. It's very brief. It's 10 questions, and it's on a rating scale. You're going to go in, Savannah's going to show us where it's located in the system, and the navigator is going to insert the youth's name and answer these questions on this scale, rating from almost never to always. So for example, the first question, youth and I agree on the tasks required to prepare youth for the future, and then you rate almost never, somewhere on the spectrum of almost never to always. And you can see the remaining 9 questions there. So it's pretty quick and easy. We just want to make sure every navigator completes this for every youth that they enroll and work with early on in that relationship building process. And then next screen, Savannah. So similarly for the youth survey, it's designed nearly identical, and it's the youth reporting how their feelings on the same scale of almost never to always, their relationship with their navigator. So first question, as a result of meeting with my navigator, I'm clear as to how I might be able to prepare for the future. So again, it's an evidence-based tool that we're using to rate the youth's perceptions and the navigator's perceptions of that coach-like engagement strategy that we're using in this intervention. It's designed to be done at 2 points in time, and we want to make sure that everybody has this completed. So this is something that you'll hear about, fidelity monitoring. The evaluation team is going to monitor and make sure that we have this completed for everyone at both those points in time, and we'll help remind you, and we've got reminders set in the system. Next slide. So the other tool then will be the graduation or the exit. We know not every youth is going to, successfully complete or graduate from pathways. There's a lot of times that youth, move away, we lose track of them, we aren't able to contact them. That obviously happens in working with this population, but we still want to be able to document the exit or the completion of youth from the pathways intervention. So, as far as successful completion goes, we consider youth successfully graduating from the program. If you go through this checklist and they've completed we've achieved the first 2 criteria, we want them to basically meet 5 of these criteria. And this is something that you complete with the youth when the youth's ready to graduate. They're not in crisis, their basic needs are met, they're in stable housing, and what stable housing looks like is going to look very different for all of our youth that we're serving. They've created or strengthened a supportive adult connection. We have number 4 in there. We've completed all the assessment tools, the baseline, they've set 2 goals, and the WAIs are completed because that's self-serving on our part, but that's required for the evaluation. We want them to have achieved 2 goals. We want to see through that relationship building and coach-like engagement that our youth have those necessary skills for independence. They've demonstrated some ability to set and achieve goals and take action to advocate for themselves. And they've demonstrated their ability to self-advocate and gain some confidence. Do we have any questions? Okay, next slide. And then I said I would touch on this CQI, the continuous quality improvement and fidelity monitoring process. It's kind of a 4-step process that you all do not need to be concerned with. This is just what the evaluation team is doing. We're monitoring the implementation. Part of that is conducting these trainings and making sure that everyone has a good understanding of the data collection process and the components to the intervention, and that it's being delivered to fidelity. We're going to monitor that through monthly technical assistance calls and ongoing trainings that you'll attend through your coach-like engagement with Jeff. And again, we're always here with any questions or concerns as they arise. We are going to be very responsive and address any questions that you guys have very quickly, because we don't want to impede the process of the services that we're providing to the youth in our evaluation and in general. And then we'll do these monthly reports. You'll see we have, kind of estimated enrollment goals based on the number of youth that you've served, that your county CHAVI program has served in the past. We've, looked at that and estimated the number of youth that we expect to enroll each month. And we're going to review that and see if we're on track, or though we're pretty conservative. So we're thinking, hopefully we'll be overachievers. But we know that might take a little bit. So we're going to monitor enrollments. We're going to show that to you. We're going to look at the characteristics of youth that we're screening in and enrolling and serving. We're going to look at what the intervention is looking like in the numbers based on the data you all enter in this system. And we're going to show it to you and get your reactions to it and make sure it looks like, oh, that, looks like, yeah, that sounds about right. That's what I've been doing, or no, this seems to be missing, and make course corrections along the way. And again, you'll have that in a monthly monitoring report. That's what our evaluation team processes looks like. And I just wanted to make you all aware of that that'll be going on in the background. Next slide. So now we're going to move into the system, and Savannah's portion. She's going to take you through the logging in and how to enter data into PMIS. So you can navigate there as Savannah takes over, but I just want to remind everyone the PMIS system was designed to be very user-friendly. It's designed to be not only a data collection tool for the purposes of the evaluation, but it's also designed to be a case management system for you all to keep track of the work that you're doing with the youth. And I know Christy and Will, our phase 2 navigators, aren't on the phone today, but I know that they have very positive things to say about this system. Over the course of many years of entering data into it, they have, the feedback we've received is that it's very user friendly. They love it, and it's helpful to them. It's designed to be helpful to you. So with that, Savannah, I'm going to turn it over to you to take everyone through PMIS.
Great. So just a brief overview here. So the Pathways Management Information System is designed, again, like Lene said, to be sort of that user-friendly case management tracking, and it's also how we can keep our tools in real time. So what it is it's a online-based secure portal where you can log in. Each user has their own individual level of permissions, so you can edit your own records, and you can see things that are in your own site, but it's, again, designed to keep youth's information safe and allow you to have a good record for you to keep track of the way that you're working with the youth through case management. And then with that, it comes with the support and technical assistance of ourselves and the people who designed the system, which is the CivicWar Neon One platform. So what I would love for those of you who are on a computer to do, if you can, we're gonna pause here. If you could, go ahead and try logging on. If you're on your phone or not able to split screen, then just try it after this. We just want to make sure that everyone has the ability to log on and then also get that first step out of the way. It's always hard to, just try logging in for the first time. So that website's up at the top. It's just that secure portal pathways.civicor.com. You will be visiting this site frequently, so go ahead and bookmark it for your own record keeping. And then you should have received an email with login instructions from us. The email that we have assigned to your username should be the one that you received that welcome email at, and the one that you registered here. Hillary is in chat to drop links and also respond to questions. If you're having trouble logging in right now, just go ahead and drop us a message or speak up. But we'll pause here for a moment. So I'm going to move on then. It looks like most of the people that are able to have done so, so we will continue. So like Lene said, the first part of that enrollment process is going to be administering the screening to youth. There are two ways to do that. There's a bar at the top that says intake, and also on your home page, which is the first page that you'll be taken to when you log in, you should see this big orange Conduct Initial Screening button. And if you want to click on that, you'll see that it pops up a couple quick questions. So it asks if the youth has former foster care experience. If yes, then they are eligible to continue going through with answering the rest of the questions. So they will pop up below. And if no, then they're not going to be a Pathways eligible youth. So we can end the survey there. But once you click yes, those questions will appear. There should be about 12 questions or so. And these are just a measure of that increased risk. So some of them will ask about, have you become homeless for various reasons? Have you used a shelter before? Have you ever been labor or sex trafficked? And those increased risk factors, if they mark yes for any one of those, then they're considered pathways eligible. After you answer those questions, there are some boxes at the bottom where you can enter the youth information. So that's going to be their name and contact information. The contact information is especially important because we want to make sure that we have up-to-date information for these youth if they drop off later. And then also, some of your youth aren't quite ready to be enrolled yet. It's possible that you could get a youth that is interested in pathways, they're eligible for it, but they're not quite sure how they feel about enrolling in a study at this time. So maybe you just save the screening for later. So you can see at the very bottom, there are going to be these 4 buttons here: save and enroll later, eligible and enroll now, ineligible and declined. So if they haven't answered yes to any of those screening questions, you can mark them as ineligible. If they decline the informed consent and they don't want to be a part of a study, you can click declined. That both of those options will end the survey, and just mark them as such. For the 2 enroll buttons, the save screening and enroll later is again one that you might use if the youth seems interested in pathways, but they're not quite ready to go into a study. That'll just save the screening and close it out. You can find that screening again later, and then you'll be able to enroll them whenever they're ready. So either after you've saved them, or if they're ready to enroll now, anytime that you click this eligible enroll now button, it will move them through the enrollment process. So once you've clicked that eligible enroll now button, you'll see this over here on the right where it says screening outcome is enrolled, and then it will say the screening is complete, and then it would like you to continue to intake. So once you see this screen, you'll click this continue to intake button, and that's going to take you to the youth's basic information page. And that's going to have just, again, very brief information. We're not trying to duplicate a lot of what's on the baseline survey. We're just trying to collect any demographics that you maybe didn't get on the screening question. Any questions that you answered on the screening question will be moved over. So if you already completed that gender and ethnicity question, it'll be moved over. If you already saved their phone number, then it'll move over. And then we just, I think, ask a couple questions about their level of education at intake, and then if they're previously, what their living situation was. And then everything in this basic information screen can be updated at a later time. So as you go along working with the youth, if they say that they've changed phone numbers, you can always come back, hit the edit button, and complete basic information. But for now, for the intake process, fill out as much as you can, and then click submit. And once you hit submit, then that youth's profile will be saved in the system, and you'll be able to find them under your home screen and under that youth screen. One thing to mention about filling in the basic information is that if you, instead of hitting the submit option, maybe you hit cancel or you hit back, there's a chance for the system to create a duplicate entry for that youth. So if that happens, just go ahead and email me, and I'll go ahead and get rid of the extra record. Any questions here? Did anyone try it? How are we doing? All right, I'm going to continue. So you've completed the basic information. The youth is enrolled. You should be able to see the youth in 2 different places. The home page is going to be for youth that you yourself have created. So if you went through while we were talking about the screening process and created a youth, they should show up on your home page. The youth section up at the top here on the right is going to show all youth that are a part of your site. So if you have a coworker, you know, Boulder County is sort of splitting, it's not exactly your caseload, you're kind of working with another navigator to take care of a youth together, then any youth from your site should show up in this youth tab. So if you go to the youth section, you should be able to see that Hillary went through and created a couple test youth for you that you'll be able to click through and follow along if you want to. So from that list, again, you'll display the study ID is going to be their unique identifier. It'll show you their first name, last name, the site, and then the navigator that created that record. You can use any of these little quick green buttons to quickly update their status, add a new goal, add a new case management record. But also if you just click anywhere in that row, it'll take you to the youth's record, which will give you more options for how to interact with them. So once you're in that youth record, it'll take you to the basic info page. That's the main portal where you'll see what you just entered when you enrolled the youth. So their contact information, try to keep it current as you go, demographics, and then contact information for any additional family members that they might have added, which can sometimes serve as an additional way to follow up with youth if we do lose contact with them. So you might want to utilize that from time to time. The other big section that you'll be interacting with is this case management tab, which is the second one in. Case management's where you're going to record interactions with the youth. So if you're meeting with them, if you have a phone call, if you text them, if you talk about any particular issues or provide services for them, again, we'll go over that section a little bit later, but that's going to be your main portal / your main bread and butter area. The other core component is when you're going to be working with the youth on goals. So there is a goals tab within the youth's record. If you go there, you'll be able to create new goals, you'll be able to see any existing goals, and you'll be able to mark any existing goals as completed as they're working on them. You can add more than 2 goals at a time, you can have multiple going. So it's really just how you and your youth want to set how you want to go forward, as Lene said earlier. The tools section is where you will find the WAI. There are a couple other optional assessment tools that are on that page, but mostly you'll go here for completing the WAI. And then this status tab is where you will go to change the youth's status if their level of engagement changes. So if you're not able to contact them for a long period of time, or they've moved out of the area, or they've returned to services after you couldn't reach them for a long period of time. But mainly you'll go here if the youth's ready to graduate. So once the youth is ready to graduate and they've completed some of that graduation criteria that Lene covered earlier, then you'll go to the status tab, and then there'll be an option to add that graduation checklist. So case management, if you go into, those of you that are following along on the computer, feel free to follow along. So entering a youth's record, you can go into their case management tab, and then they might have, or if you've entered any records for them yet, they'll have a date of contact. It'll sort of give you a snapshot of the contact itself, any services that were provided, and then a little excerpt of what you worked on them with. So the notes and comments section is pretty much going to be for you to see on this screen at a glance what's going on with your youth and a record of how you've been working with them. This is used to sort of track the intensity of the intervention. So like we said, we kind of want you to have at least 1 contact with the youth per week, as long as they're in the active phase. And that just helps us track, how many meetings does it really take with youth to build relationships? How intense is our intervention compared to services as usual? So creating a new case management record is pretty straightforward. Like Lene said, a lot of the things in the system are just going to be button clicks. Under the case management, you'll see this green add new case management record. Once you click that, it will pop up a little window here that asks you to describe what date the contact occurred on. You can backdate that. So if you're entering all of your records on a Friday or something, you can go ahead and backdate anything that you want. Whether or not the contact was in person or on the phone or through a text, if anyone else participated in that contact, if it was a meeting with a partner or another parent, and then any issues discussed. And you can check as many of those as you need to. So if your youth talked to you about education and employment all in one breath, again, we just want to know that you met with them the one time, and then you'll be able to list in the notes and comments what you covered. The last thing within the case management record is when you're creating a new one, if you've provided any services for them, that's going to be under that notes and comments section. And services are just a way to sort of add on if you did provide a service or a referral for them. So I have an example over here. Here's kind of what a completed case management record looks like with an added service. So we met with the youth on the 15th in person for about 11 to 20 minutes. We talked about employment and well-being, talked about their worries about finding a job and starting a work plan. And then the type of service that we added was the services array, which is flex funds. Flex funds is any time that you're going to use flexible spending dollars to meet with youth. So in this case, it popped up another window where we added comments to say that it was a lunch meeting, $15 was paid, we went to Panera. You can make these as detailed as you want. Again, we just kind of want to capture the level of involvement, and then of course, if you spend any actual flex dollars on the youth, recording how much we're spending per youth is excellent for helping us dial in the intensity. Okay, any questions on case management before I move on?
Just,
All right.
I do have a quick question. It's kind of petty, but for some of the selections that you have, like if there isn't an other option, but we just don't think any of the selections fit, like for the flex funds, if we buy something or have some sort of meeting and we're paying something that isn't on that list, how do you want us to document that?
So I think that it's a check all that apply, specifically for the flex funds or the services array. A number of those types of service categories, when you click them, will open up a new window, but a lot of those fields aren't required for you to fill out. And if you find that you're frequently running into a type of service that isn't there, I do believe that I added an other category. But if you're running into something where it's happening frequently, that you're using a type of service and you want to be able to capture it more accurately, we have the option to add extra categories to the system. So that's something where it would be really great feedback for me if you said, hey, we're frequently doing this service for youth, can we add it to the list? And I think that we're happy to look at that, investigate it, and make sure that it's working for you. Because for fidelity's sake, we're mostly looking at how many, how often, average per youth, and then again, if you're capturing those dollars, any additional types of that. So whatever makes the system more functional for you guys beyond that, we want to hear that from you.
Awesome. Thanks, Savannah.
Thank you. All right, we're going to move on to goals then. So goals is another big part of the Pathways intervention. You should be working to set at least 2 goals with youth within 90 days of their enrollment, to set new goals with the youth. And again, this can be anytime after you've interacted with them and built a relationship, and you can say, what would you like to work on as part of our intervention? Because we're going to work together to set goals for you and then to get them done and teach you how to do it. So within the system, where you can do that is there is a goals tab within that youth's record. And there's that green add new goals button, which you will use to go ahead and start creating a new one. Any existing goals will also be displayed in this section. So for this example, they have 2 goals, one for housing, which is they'd like to get on the list for housing vouchers, and one for permanency, which is to strengthen a connection with their English teacher. And then one of them has been achieved. You can see here the date goal achieved has a date completed. Any goals that don't have that date achieved are counted as still in progress. So adding goals is pretty straightforward. The categories for goals, the type of goals are listed mostly along those outcome areas for Pathways, which are housing, employment, education, permanent supportive adult connections, and then anything general health and well-being. Try to make the goals as specific and separate as possible. So a youth might say, I want to be healthier or something like that. And that's a great goal, but it's also an opportunity to work with the youth to drill down further. What does being healthier mean to you? You can set a health and well-being goal of, I would like to learn how to cook at least 1 new dish, or I want to learn how to do healthy grocery shopping, or I want to start a gym membership, anything like that. And then each goal is going to be reflected here with the date that you set it. You can describe the goal in detail so that you can revisit it as you go. And then you're just going to work on revisiting those goals and encouraging youth to complete them. So once they are completed, once you and your youth have decided, we did this, you know, we've been working towards it, we got you on the list, we did this thing, then you can go into the goal by clicking edit, and then you'll be able to mark the goal as achieved. Next, we'll get into the Working Alliance inventory. The Working Alliance inventory, like Lene said, is that measure of coach-like engagement. The youth and the navigators are going to complete them separately, and they're administered at 2 different points in time. The system does have automatic reminders for when those are due, which will appear on your homepage. So any youth that has an outstanding WAI that they need to complete will appear on your homepage with the outstanding WAI, and that will give you an opportunity to resend them a link. And it's also going to prompt a reminder for you on your homepage saying, here's this youth, we need to complete it for the navigator survey. So there are those questions, again, for the navigator and the youth. We'll go over each of them separately because they work a little differently. So for the WAI for navigators, which is you guys, you can complete them directly within the PMIS. So this tool is going to be located under the specific youth that has the tool due. So again, on the homepage, you'll see which youth have a WAI that they need to complete, and then you should get a reminder. So you'll go into that youth's record under this Tools tab, and then there's going to be a bar that says Working Alliance Inventory for Navigators, and you'll complete the first one at around 5 interactions with the youth or 6 weeks, whichever comes first. And then once you've completed this in the system, this will gray out, so you won't have the ability to fuss with it again, and it'll mark it as being recorded. And then when it comes time to do that second one, which is about 9 months after the youth is enrolled, and you'll get another reminder on your homepage, then you'll click this Add Second WAI. The questions will pop up automatically, which is what you see over here on the left, the navigator survey with that scale of almost never to always. And then once it's done, click complete, it will save it in the system. So that one is fairly straightforward. The WAI for youth is just a little bit different. So the WAI for youth will automatically be sent to the youth if they have a valid email. So 6 weeks after they're enrolled, the system will just send an email with the survey link to the youth with the email that's logged in the system. If the youth doesn't have a valid email, again, they're going to appear on that homepage and let you know that they need to complete the WAI, and it's going to appear in red if there's no email address. If they have an email address, you have the option to resend it directly from there, or there are a couple other workarounds in the system. So if they have outstanding WAIs, they'll appear on that homepage. You can send the links manually. How you'll do that is if you go to the Tools tab, there's going to be another section here that says Working Alliance Inventory for Youth. These first 2 green buttons will pop up if the youth has an email. So you can just click that resend button. If you figured, oh, they didn't have an email entered, now they do, you can just resend it. Easy. If for some reason they're not able to access their email or they're having trouble getting into it, there's an option to copy the link to the survey directly to them. So if you have some sort of in-app messaging, you can copy the link over to them directly and text it to them, or you can write it down on a sticky note so they can open it up in a browser and complete it themselves, or you can complete it with the youth with their permission. Again, ideally, we'd like the navigators and youth to complete it separately because then you're more likely to answer honestly and share your feedback confidentially. But helping the youth complete this tool is something that we're trying to do. So that was the WAI. Any questions for that one?
Are there any other points where, sorry, I'm just going to turn my video on. Are there any other points where it's going to be required for youth to have an email? I really like, because that was going to be my question here. Sometimes we have youth who are using foster parents' emails and then maybe they leave that home and things like that. So I like your options of sending them a text or things like that. But are there any other situations with the system where it is required that the youth has to have a valid email?
This is the only point in the system where it will do something automatically to prompt them. And again, you'll have the option to copy that link directly, but most of the things that you're doing with youth are going to be direct. So you'll have the system in front of you, working with the youth, entering the case management that way.
Okay, perfect. Thank you.
And we talked, that's a good question, Kim. We talked a lot about this and designing kind of the study and how we're collecting data with youth, and, you know, and got feedback not only from youth, but also our, you know, phase 2 navigators. And they said that, you know, the youth that they work with, if they don't have an email address, the navigators always help them create one, because it's kind of critical in, the work they do with the youth, whether they're communicating and applying for a job or for school or for whatever it is. So the current navigators, or our phase 2 navigators, felt like there was a rare instance where youth didn't have an email address, and if they didn't, they set one up for them. So hopefully that's the case going into phase 3. I know we're touching a lot more youth, but we certainly would want encourage navigators through the work they're doing with the youth to, help them create a valid email address and manage their email accounts, help, work through that process. So hopefully that's helpful. Also, the texting a link. Most youth have phones, and if they don't, there hopefully is a path to getting them one. So again, the communication piece and making sure that it's not just about data collection. I don't want it to feel like, this is obviously the data collection training, so we're very heavy on data collection today, but that relationship building and communicating with the youth and helping them kind of achieve their goals and supporting them in doing that is really what's important here. And we all in life have phones and email addresses. So we're hopeful that this is going to work. And again, if there's suggestions along the way for this is just not working for us, we're here to help kind of troubleshoot what the best methods are for getting these things completed for youth. So just wanted to throw that out there. Thank you.
Great.
Sorry for interrupting, Savannah. Go ahead.
Oh, no, please. I love it. So as Lene said earlier, and I might have mentioned, sometimes the youth will change the level of engagement with Pathways. So if they're working actively with their navigator, if they're in regular contact, they're responding, they're following up, then they're going to be marked in the system as active, which is something that we should do after we've enrolled them and they've started working with their navigator. They're considered in the active phase of the intervention. But sometimes you'll have a youth who is a little bit disengaged, or they're not quite sure if they are trying to respond or work as intensely with the navigator. Maybe it's been about 30 days or something and they haven't reached back. You're not able to contact them. We want the status to be changed to update their level of involvement if you can. So you can just go ahead, if a youth is disengaged, mark them as inactive, which is done through the status tab. And then if the youth has sort of moved out of the service area or said, I don't want any more services from you, and they're unlikely to return to getting services and being active, then you can go ahead and mark them as closed. Statuses are updated within the status tab for the youth. So this little section here, and you'll be able to click this green Add New Status button to change the youth status. That doesn't mean that they can't continue getting services or that you're not reaching out to them. You can always try to continue to get the youth re-engaged if they haven't yet graduated. So if a youth becomes inactive, you can go ahead and remark them as active if they start returning to services and working with you.
Savannah, can I ask a quick question about that?
Please.
Is there any, sorry, this is Amanda Macaluso with Boulder. Is there any like limitation to how many times a kid can come in and out? Does that ever come into play?
I don't think that that's been an issue with any of our phase 2 families, and it's certainly not something that we've thought about in terms of setting a hard limit to being able to return. Mostly the thing is, we want them to have a relationship where they totally feel comfortable returning to you and asking for follow-up services. So there isn't, I haven't noticed in the system a whole lot of like a revolving door kind of thing. And marking the youth as active, inactive, closed is kind of just another way for you to sort of track if they're disengaging, if they're starting to, or if they're part of what you want to call a more intense caseload. So it's just a way to figure out, what is their endpoint? How many youth do we still have working with navigators, and how many of them have decided that they don't want services or they've moved out of the area and you're not able to contact them, versus how many are graduating. So that's kind of the key point here for us.
Savannah had that just right. And just to reiterate, it really is a tool with several, there's several reasons for it, but one of it is really just to have the navigators be able to quickly see, oh, I've got 10 active youth. That's, a lot of active youth to be providing services to. Where I've got 3 active youth, I can enroll more youth and serve more youth. So it's going to help you guys kind of manage that caseload. It's not, we think, about 7 to 10 youth actively you're engaging and working with is about the most that you can, kind of deliver this intervention to. And that's, not hard and fast numbers. That's kind of what we've learned from phase 2. We don't really want you actively working with more than 10, 10 meetings a week is a lot. And how effective can you be in that relationship building and goal achievement? Providing that number of services to youth and meeting that consistently. So it really is, the status tab is really a tool for you all to kind of manage your caseload and see where you're at in the work that you're doing with the youth. And then Kim had a question I saw about, the fixed choice response on that aged out. That was from phase 2. That was before we had our extended foster care passed in Colorado. And so actually that's something, yes, it does mean aged out of foster care, not aged out of pathways. They're not going to age out of pathways. And I think that's actually a response category that we can get rid of. And that also brings up another point. If there's something that is missing in the system in one of the response categories that you find yourself marking other, and that's in any of these fixed choice responses, please let us know and we can add that very simply. We can add and delete categories. We can make minor adjustments or minor edits, I would say, to the system. So we're always, looking for feedback because again, this is a system designed for you all to provide updates and keep good case management records for yourself. So if there's something that's missing or something you'd like to see different, then, let us know and we can make those adjustments as we, provide intervention, enroll youth and serve them.
Yeah, great question.
And supervisors should, oh, sorry, Savannah. Also, Amy had a question. Supervisors should be able to see all of the youth in the site that are being in your site that are being served. And supervisors also have navigator level access to the system. So for example, if there's staff turnover, if there's a backlog on the number of screenings that are being, referrals being sent over, the supervisors sometimes can enter those into the system and, assign them to the navigators to provide services as, they kind of keeping that process going. Okay, I'll be quiet now, Savannah, thank you.
Oh, no, it's great. I love when you tackle questions and also great questions. So thank you everyone for being engaged, and that means that we're doing good. So the last thing that you can do within that status.
I have sorry, this is Amy. Speaking to that, Lene, like when I hit on, so I would hit on youth to be able to see all the youth that are with all of my employees, right?
Yes, so the youth section will
Yeah,
show
and
you
I
the
just
site.
realized Amy is going to be different because Amy, we'll take this offline. We're going to have to figure something out since you have Will in the Northeast region and you have Arapahoe Douglas.
Okay.
That's probably why you don't see Will's, because you're probably assigned, I'm guessing, to Arapahoe, and the permissions are restricted, so you can't see. Boulder can't see Denver's cases, for example. So we're going to have to fix that for you. Yes, you should be able to see everybody's.
Thank you.
All right. So then the other status is that they're going to be graduated or they have completed pathways. That is also going to be within the status tab, which is where we'll have that graduation checklist that Lene covered earlier. So if you go to the status tab, once the youth is ready to graduate and they've met some of that graduation criteria, they've set goals, they're in stable housing, they're not actively in crisis and their basic needs are met, then you'll go to that status tab with the youth. and then you'll go ahead and click this blue Add Graduation Checklist button. Once you do that, it'll pop up the actual checklist itself. It will require that you fill in those first 2 criteria, that their basic needs are met and that they're in stable housing. And then you'll click 3 additional criteria that they have met. Either they've set goals with you or they've completed all of the tools within the system. You can mark as many of those as apply. Some of them will require that you fill in a little bit more information. So one of the categories, for example, is demonstrated increased ability to self-advocate. So if you've checked that box, then we just ask that you sort of list 2 examples of how they've met that criteria. But once you've completed that checklist, you can hit save and submit, and then their status will be reflected as having graduated. You can still provide services to them as part of the intervention. You can still do case management with them. But in general, the goal of graduating youth from Pathways is to sort of transition them to greater self-sufficiency. So with the goal of working towards them graduating from Pathways and having greater efficacy to set and achieve their own goals, we're really teaching them life skills. So the idea is that we're working with youth towards a lesser intervention over time. So you can continue serving them, continue seeing them, but in general, we sort of want you to transition them into greater independence if they're marked as graduated. That is the plan of getting them ready for the next phase of their lives. All right. And then there's just a couple fun things that we built into the system that should make it easier for you. They're not requirements of the intervention. This is just additional system functionality that's built in. So referral agencies and contacts are across the top bar where you see the home page and the admin functions. And these, if you go into them, are just sort of lists. They can be your sort of personal Rolodex for agencies and people that you're interacting with very frequently. You'll have the ability to add new referral agencies and contacts. And this is just, again, a way to sort of virtually keep your contacts in one place. And all navigators can see contacts and referral agencies that are entered. So this can be a resource not only for yourself, but for your other people in your site, where you can set it so that it's got very clear notes on here's what they do, here's the county that they work out of. It's just a good way for you to keep track of those things for your own personal uses. Additionally, we have a place in the system where we have documents located for you. So most of the tools that are required for Pathways are built into the system already. The graduation checklist, the WAI, the screening tool, those are just there. But we know sometimes, this population's kind of mobile. Maybe you're not right in front of your computer at a time and you prefer to keep paper instruments. If you need to access those, we should have sent you hard copies of those already, but they are located in the system as well if you ever need to download them. And they're going to be located under admin functions, which is next to the home tab. And then that drop down documents for navigators. You should be able to see any of the documents that we've uploaded and then download them. And then from there, you can print and use them as needed. There are a couple optional tools in there as well that navigators in phase 2 sometimes used, including the CANS, the Youth Connection Scale, the Casey Life Skills. These aren't in the system per se, but you'll have the option to upload them and attach them to a youth's record. The CANS, especially in Casey Life Skills, are these big comprehensive measures that could be really fun to work through with your youth, but they're not built in per se. So you can complete them either on the computer with the youth, or you can print them and scan them, and then you can keep them as part of the youth's record by going to the Youth Documents tab. So Youth Documents is going to be located in their own profile. So you enter the youth that you're trying to add this record to, and then they have a Documents tab where you can go ahead and add or upload anything that you want to keep track of. And that could be scans of a birth certificate, that could be a report card, anything that they want to keep and have digitally and not lose track of for your sake. Or it could be, again, a tool that you completed with them that you just want to be attached to their record. So these are additional places where we've put flexibility and functionality in for keeping things attached to the youth for you.
Savannah, I'm so sorry. I have another question. I have a lot of youth who transfer from my county back to their home county.
Mhm.
Can, like, if I close a youth, for example, but I also have all of their documents in there, like their Ansel Casey or whatever,
Mhm.
and I close them, can anybody else open them? I guess, like, is there a way to basically transfer cases from one county to another or from one location to another?
So in general, we have it organized by site. A lot of counties are served by the same site, so they can see and edit those records and have access to them. But additionally, we can switch caseloads. So youth are kind of assigned to a site and they're assigned to a navigator. So if they have left their site that they were originally being served by, and you want a different user to be able to have those records because now they're serving the youth, then yes, as long as they are a PMIS user, we can go ahead and transfer and make it so that they can also have access to those.
That's a
Awesome.
good, thank you for that question. That brings up a point that I also would like to make. In phase 2, we did learn, we saw youth transfer from, Boulder County to Larimer County, or, from one county to another. And the intervention is designed to be mobile in that we want navigators to continue, in building that relationship with their youth and monitoring and supporting them, across various county lines. If a youth moves, so far away across the state, and you're unable to do that, I mean, we still want you providing services to the youth. Once they're enrolled in pathways and in the study and are getting the intervention, we want them to continue to get the intervention. So that might look different for youth that move. If the youth moves to another county, let's say they are in, I don't know, somewhere in Pueblo, and they decide they want to go to school at CSU and they move to Larimer, then the navigator in Pueblo, based on that relationship they have with the youth, if they want to transfer to a navigator in Larimer County, the navigator would facilitate that relationship. And then in the system, you can just let us know. We can change the site, and then the relationship can continue with the navigator in Larimer County. Now, the caveat is if they move from a intervention county to a comparison site county where there's regular Chafee services, that doesn't mean they wouldn't be transferred in the system, because that youth is in the intervention group. We're going to continue to track that youth's outcomes over 12 and 24 months. And we want that youth to continue to receive intervention services. Now, they may transfer to an inactive status. They may complete the intervention and reach back out to the navigator in time, if something comes up. But we want to continue that relationship and that intervention services till they get to the point of completion, with knowing that they can come back and receive services from their existing navigator. So we're not going to transfer youth from intervention to a comparison county. And likewise, that's not going to happen in the system if a youth enrolls in intervention and would never move to the comparison group. So we have to keep those counties distinct. Those youth, I guess, when they enroll and where they enroll, they're distinctly different, and those won't ever cross. But youth can cross, they're mobile and they can cross boundaries and counties and continue to receive services. So I guess it's a long way of saying, once they're enrolled in the intervention, we want to make sure they're getting the full intervention. They're going to always be enrolled in the intervention, and we're going to follow them and track their outcomes. So any questions about that? I know I just said a lot. And again, we're here to help kind of troubleshoot that. If there are questions and concerns, it's going to come up, and that's why we're here. We can help facilitate that process. Back to you, Savannah.
Great. Like Lene said, getting stuck happens, and that's what we're here for. So especially when you're first learning a new system, it's one more thing to learn. We tried to make it really clear and stick to just in this training the parts of the intervention that are required as part of it. So there's plenty of other things in the system. There are areas that you might run into where you go, what's this for? Or how can this be used to help me? Or is this important? Or help, I got stuck on this screen? Or help, I duplicated this youth. We're here for that. So if you need any immediate assistance with a PMIS related issue, go ahead and email me directly. My email is there. And then, of course, refer to your training materials. Hopefully, we will have a recording of this training up, and then we also have the user guide for you. So please reach out when you run into anything. And I actually mean anything, especially in the beginning. It's hard. So let me know as you go along what you're running into, any questions or curiosities you have, anything that you need added to the system, anything that you go, hey, this would be really neat to have. Where would it make sense to put something like this? Or is this something that we can add? Anything like that, we're happy to hear from you. And then that's kind of it. We threw a lot at you. We've got 30 whole minutes left to take any questions and hear feedback. So have at it. Unmute yourselves, have an open discussion. Let's go.
Hi, this is Katrina with Pueblo County. So if we enroll youth in pathways, are we also going to still be enrolling them in trails, or is it just going to be in this program?
Trails data entry is still required. So yes, you'll still, enter in trails what you always have entered in trails. This is in addition to that.
Okay, so we'll document what we did like we normally do in the group activity and trails as well as in this system.
Yes. So like the case management records, is that considered what you're thinking is similar to the group activity in trails?
Yes.
Yeah. So so as far as what's required for the evaluation, the enrollment, that assessments box that we had up here initially. So the screening tool is going to be completed. And then of course, the baseline survey enrollment process, and then the WAIs and your case management records are really designed for the navigators to keep track of the work they're doing with the youth. And we'll also be monitoring those meetings, kind of the frequency of the meetings and what they look like. And then the graduation criteria checklist and both of those, the WAI for the youth and the navigator. And this is quite a bit scaled back. I mean, we recognize, data collection's a necessary evil, that there is duplicates, it is duplicative to some extent, but I think once you get in there and get used to it, it's pretty quick. And again, it's much scaled back from phase 2. We were trying to be as lean as possible with what we collected in PMIS, knowing that, data collection is a burden and that trails is also, we're going to get the outcomes from trails. So it's, critical that you're still entering information in trails as well.
Right. And I can't speak to the rigor of the trails system in particular or what your requirements are for entering those. As far as just the evaluation and PMIS recording goes, again, when we're looking at case management, if you already have to enter a full note and the requirements for trails are that you be as thorough and complete as possible, and then you come back to having to do it in case management, from the evaluation side, we're mostly just looking at it for a measure of intensity. We want to know that you're meeting with that youth at least once a week. We want to know that you are providing referrals to them and working on goals. But if you're already doing some sort of note keeping in trails or another system, and you're not going to need to rely on that same copy and paste description back over to another form. Very seldom have we gotten into the notes and comments to see exactly what you're doing with the youth. So if that section's helpful for you to fill out, then please do it. We tried to make it as easy as possible. But if you're already sort of doing that elsewhere, we really just want a measure of intensity, right? Are you meeting with the youth as we said that we were going to as part of the intervention? And then the rest is kind of fringe for your record keeping.
There's no required notes you won't be typing anything in PMIS unless you want to as part of the work you're doing with the youth. Everything is a button that you check or a drop-down menu.
This is just a curiosity question. At the end of this pilot, is this data is the PMIS system going to be available if people wanted to adopt this in general? Maybe you don't know that.
I don't know that, but yes, that's always a possibility. So it's certainly, CPR is the one that designed and built this, and it's housed, with the engineers at a tech company that does database design. And so yes, that's a possibility down the road for sure.
And I say that as a compliment. I really like this system. So
Thanks, Kim. I love that feedback.
that's why I'm asking. I'm
Yeah.
like, maybe we could adopt it. But
You sure can. Do we have any other questions? Everyone's an expert on PMIS. I know it's a really easy system to use, so I appreciate that. We'll assume you all got it. You got in, you figured it out, and we're here with any questions or follow up because we know there will be, you're going to get hung up on something. You're going to have a question about something, and that's what we're here for. So I appreciate everybody taking the time to attend today's training. Again, there's a recording of it. You've got a user guide that you can refer to, but I would encourage everyone to familiarize yourself with this system. There's test case in there for each of your sites, but you can create another test case. We will clear all the data out right before enrollments begin, right before study enrollments begin. But until then, create test cases, get in there and play with it. You're not going to break it. I challenge you all to break it. Just, get in there and mess around with it and familiarize yourselves with it. And be in touch with any questions that you have as you, go through this journey with us.